you'd like, you can go ahead. Oh, look at that. You can go ahead and start the recording, and you beat me to it. Fantastic. All right. Thank you again for being with us today for our second Learning Community Call. And we have a very full agenda and team present here today to support you. I want to acknowledge our extension colleagues that are a part of our technical assistance effort through MCH supporting the adolescent well-being area. We have Jen Braun joining us today. We also have Debbie Moellendorf, and also part of our team, Taylor Seal. In addition, Amber Canto, Zoe Gibbons are part of our team and not present with us here today. With that, we have, as I mentioned, a very full agenda, lots of things to cover, lots of information to share with you. We will hear from Kara and Heidi if there are any updates on their side. We also have colleagues from the County Health Rankings and Roadmaps here to share some data access and updates with us. We have the Comprehensive School Mental Health Framework consultant from the DPI, Libby, joining us today to really help us learn how we can best engage with our schools and the tools and strategies that might be most beneficial in the work that you all do, and how extension, health departments, and our schools can really work together moving forward. We also have some of your colleagues here today to share examples of how health departments and schools have formed collaborations around the state. We'll hear from a member of our youth wellness team in a video, and we'll close out our day giving you an opportunity to give us some feedback, share your comments, and remember how to contact us and engage with us as we go throughout this process of supporting you as your technical assistance provider. All right, with that, I'm going to turn it over to Heidi and Kara if they have updates to share with the team today.
Sure, this is Heidi Massey with DHS. A couple things for you. Q1 reports are due by April 30th. That's for your work that's been done January 1st through the end of March. You should be able to find that from a link that Mary Cush had sent out. If you cannot find it or need help with something, please reach out to me and I'll try to help you figure out where it's at or what you need to do next. So just if you can't find it, let me know. And then if you need more time, also, if you aren't going to have it done by April 30th, let me know as well. So I'm aware that you're working on it. The next thing is the community engagement and health equity learning calls. I sent them out the first one was last week, and that was on languages. I hope some of you were able to attend. They're optional, and it was recorded, so we can get the recording to you. The next two, you're also you're also encouraged to attend as you're able, and that's on June 16th and October 15th at 10 o'clock. And those links I did send out. If you didn't get it or have any questions, let me know. So Kendra Smith is the TA provider for community engagement and health equity. And she's also willing to do TA for any agencies, any health departments around their objectives. So if you want to reach out to her to schedule some time, you're welcome to do that. And then additionally, Kendra has offered to join any learning calls or office hours. So that's also an option for adolescent well-being. And then the other thing I'm just going to put in the link is the youth engagement tool. Just everybody should have that, but if you haven't seen it and it's one of the requirements, making sure that you have access to it and know what it looks like and are using it. So that's all the updates that I have. If there's any questions, I'm open for those as well.
Great, Heidi, thank you so much. Our extension team will also monitor the chat. So if any questions come up, please feel free to put those in the chat. You can also unmute. We love to hear your voices as well. So don't hesitate to unmute and share your questions out loud, but we will monitor the chat throughout the presentation today as well. And Heidi, thank you. I see that link in there. We'll make sure to send that out as a follow-up too for the youth engagement assessment tool. All right. So with that, we are going to keep our agenda moving along because as we mentioned, we have a lot of information. We have a lot of guests here to present and share with you today. So we are happy to welcome our colleagues from the University of Wisconsin Population Health Institute. They are here to talk about the county health rankings and roadmaps, lots of updates and data that is available to you as you engage around all varieties of and all avenues of the work that you do today. So you all should have screen sharing access. I will stop sharing and mute myself and let you take it away.
Thank you so much.
Thank you.
Can everyone see my screen?
Yes.
Okay, thank you so much. Okay, so good afternoon. My name is Molly. I'm a member of the data and analytics team of County Health Rankings and Roadmaps, and I'm really excited to share the work that we do with you all today. I'm joined today by Harry, who's another of our data analysts. So at County Health Rankings and Roadmaps, which we like to refer to as CHR&R for short, we believe in a future where everyone has opportunities to be healthy and to thrive. And there are many factors impacting how long and how well we live, from opportunities we have to access fresh foods and safe places to play, to opportunities to participate in the decision-making processes. Our data resources highlight some stark differences in health that stem from historical and current policies and practices. And we also want to lift up strategies and solutions that you can use to take action in your community. We know that when we work together, we can improve health for everyone. At CHR&R, we've introduced a new approach and sharper tools to help you understand how long and how well people live in counties across the nation. We've replaced our previous county rankings, which were only available internally for each state, and this year have moved to a presentation of health summaries across a national spread. We hope that these changes will support an even stronger local and national movement towards health and equity, so that everyone in every community has the resources and conditions to thrive. So what you're looking at here is an example of what I've just been talking about, the County Health Outcomes Summary. Health outcomes are how long and how well we live in our communities. This graphic indicates how a county fares relative to other counties in the state and on a national continuum of health. I want to emphasize for those who've previously used our data that this new health outcome summary is replacing the ranks that we've previously assigned to counties in the past. So let's explore this graphic a little more. Here we're looking at Eau Claire County in Wisconsin. That's represented by the dot that's circled in purple. On this graphic, you're seeing health outcomes data for the 72 counties that make up Wisconsin. Each dot represents one county. The dots are placed on a continuum from the least healthy to the healthiest in the country. So this graphic shows us that Eau Claire County is faring about the same as the average county in Wisconsin for health outcomes and better than average for the average county in the nation. So the state and national averages are represented by those two dotted vertical lines. Another way of viewing this, you can see on our state pages where you'll see the exact data I was just showing you, but now in map form. This is a map of Wisconsin's health outcomes, which is included in the state snapshot. As I said, here you can see the same health outcomes illustrated in dots, but now in map form. This allows you to see how your county's health is meaningfully similar or different to the health of your neighboring counties, and can also show us where those differences in health may be within the state. The color of each county on the map represents those groupings that were also in the bottom of the last slide. And these data-informed groupings draw on health information for all US counties. So I know that was a lot, but for now I'll pass the mic to Harry, who's going to walk us through the data and county snapshot where you see these maps and graphs integrated into our website. Thanks, Harry.
Can you switch? Okay. Thank you, Molly. Now moving on to types of data. For each county, we summarize demographic data to describe the makeup of a community according to characteristics like age and population size. And we also provide data on the health outcomes experienced by the people living in the county. How long and how well do people live in here? This is where we calculate measures such as life expectancy and mental health experience. We sometimes talk about these outcomes as today's health. So we talked about health outcomes, which is one of our primary summary measures. The next important summary measure is health factors. There are many factors that impact the future health as well. And our model of health sorts these health factors into the following categories: health behaviors, clinical care, social and economic factors, and the physical environment. When you visit our website, countyhealthrankings.org, you can explore our model to see how these factors influence community health. While you're there, you can also take a look at the rest of our measures. It is important to note that CHRNR has data for over 80 health-related measures, which are updated annually in our data release. Select measures are used to calculate health outcome and health factor summaries for each county, while the other measures contribute context to these summary measures. And you can kind of follow that in the picture of the model here. Okay, next slide. Now let's have a walk through the CHRNR website to see how users can find information about health in their own county. I want to first mention that we'll have a navigational video tutorial on our website that is very useful for people interacting with the website for the first time. And I'd like to start on our health data overview page. You can access this by selecting health data from the navigation bar at the top of the web page. As you can see here, circled in green. And there are 3 ways to access information from this page. So the first one is searching by geography, which includes county, state, or zip code. You can search by topic, or you can download full data sets. For our overview page, you can also search directly for counties to find your county snapshot. This is a county snapshot for another Wisconsin county, Adams County. State level snapshots can be accessed by searching by state, and these pages will mirror the county snapshot, but will include interactive maps for all counties and congressional districts in the state. Every county is introduced with a description, which includes a link to identify the indigenous nations native to the land, the county's connection to large cities, and a brief description of the county's connections to neighborhoods that have experienced redlining. In this same section, you can select Show Demographic Data, which is another tab, for a demographic breakdown of the county. Okay, so let's review this visual again, which we saw previously. You can see how Adams County fares relative to other counties in Wisconsin and in the nation. These data-informed comparisons focus on meaningful similarities that can support solidarity and action to improve health. With these graphics, we can see the state minimum and maximum in relation to the healthiest and least healthy county in the United States and the national and state averages and the placement of your chosen county. A similar graphic is available on each snapshot to illustrate the health factors, which is a different or the other type of summary for each county. Here you can again see the relation to other counties in the state as well as the national distribution. Scrolling down on the page, you will find a table providing county, state, and national level data for each health measures, which kind of look like what we're seeing here. And then in this table, you can also select areas of strength, which are highlighted in purple, representing areas in which your county is doing well, and areas to explore, highlighted in brown, representing areas that might need improvement. And we want to acknowledge, however, that these 2 sections are just starting points, and that knowledge for within the community should always be prioritized when choosing areas of improvement. So now let's take a closer look at an example measure, children in poverty measure. An expandable section attached to each measure called a measure drawer is basically the one-stop shop for all information regarding this measure in the specified county. At the top of this drawer, you'll see a definition of the measure, a context statement, and the years of data used. If available, the measure's data will be presented by race and ethnicity. This can help show how different racial ethnic groups are faring within a county and community, an equitable experience which would otherwise be hidden at the overall county level. And some measures will also include a downloadable interactive trend graph that shows county, state, and the national data over time. In the left column of this drawer, you will find 3 additional sources, linking you to measure methods and limitation, evidence-based strategies that can help you address this specific measure, and a state map showing how all of the counties in the selected state compare on this measure. At the bottom of both the county and state snapshot, you will find a link to our improved Compare Counties tool. And finally, here you can compare up to 4 counties, including the creation of a single trend graph encompassing all 4 counties. You can also use the Compare Counties tool to find other counties in the state similar to your county in terms of size, demographic, and key economic indicators, according to the CDC's peer county groupings. And with that, I'll pass the mic back to Molly to discuss our What Works for Health strategies.
Thanks, Harry. So the What Works for Health strategies are the next step after you've looked at your data, and these help you answer the question, how can we take action to improve health in our communities? We've included more than 400 evidence-informed strategies in our What Works for Health database. Each strategy offers a summary of the research and provides examples on how it's being used today. Many will also include an analysis of that strategy's potential impact on equity. So when you go look at a strategy, this is essentially what it will look like. Below the strategy's title, you'll see a description of the basic concept. And on the upper left-hand side, you'll see an evidence rating. These are the quickest way for you to assess what the evidence says about a strategy. What Works for Health has 6 evidence ratings. These range from scientifically supported, which is the strongest evidence of effectiveness, all the way down to evidence of ineffectiveness for programs that have either conclusively been shown not to work or that cause harm. Returning to the text, you'll find the expected beneficial outcomes. These are the main outcomes suggested by the literature that have the strongest support. We also include other potential beneficial outcomes, which have weaker evidence but may still be worth considering. Below that, the evidence of effectiveness summary includes what we discovered in our literature search, including additional details about the expected beneficial outcomes, the populations that may be most likely will be most likely to benefit from the strategy, the best practices, and barriers to implementation. Further down on this page, you'll see the strategy's impact on disparities. We're currently expanding this section to include a summary of evidence supporting the rating, historical context, and considerations for implementation. The implementation examples section is where we feature recent information about organizations that have used this policy or program. This includes examples from different levels of government, urban and rural locations, and so on, trying to give you an impression of the breadth of its use. Just below that are important resources we've added links to things like toolkits, guides, and key organizations that may be helpful when starting your journey in using this strategy. So as part of this year's annual data release, we've analyzed 3 new strategies that focus on civic health, or the degree to which citizens participate in their communities, from local and state government to interactions with family and friends. Our strategies focus on 3 ways that residents can participate in their communities: public libraries, labor unions, and public deliberations. Public libraries are important spaces for people to connect with their community. Labor unions support workers' rights, and public deliberations offer people a way to become more informed and give their input on decisions that affect their lives. You can check out these strategies and those that we added last year that also focus on civic health. These strategies added last year include voter registration initiatives, voter turnout, participatory budgeting, and civics education. And finally, this year, CHR&R introduced a curated list of 45 measures that, again, specifically focus on civic health. There's lots of ways that you can grow your community's civic health. These include creating spaces where people can connect, learn, and act, improving governance and resource distribution, and nurturing social networks and shared culture. This curated list provides evidence-informed strategies that can strengthen opportunities for people to participate in their community, which we know can lead to better health. We've previously released curated strategies for racial wealth building, climate change, and violence prevention and community safety, all of which can be found on our website. So in closing, I wanted to share one more resource with you, which is our In Solidarity podcast. This is hosted by our hosts, Erica Burrows-Girardi and Beth Silver, exploring connections and interviews with some of our country's brightest minds and biggest thinkers. So far, we have 3 series posted. with a fourth ongoing. These have focused on the racial wealth divide, gender pay gap, and civic health. We want to encourage you to stay connected to CHR&R by subscribing to our newsletter, which is the best way to learn about our upcoming webinars or updates. And you can also find us on Twitter, now known as X, on Facebook and LinkedIn. And with that, thank you so much. We'd love to hear any questions you have.
Thank you, Molly and Harry. I'll talk for just a second while maybe people are typing their questions in the chat or getting ready to unmute themselves and ask questions. For all of you that are joining today, County Health Rankings and Roadmaps has historically always been a very valuable source of information for county-based prioritizing and strategizing. And now with all of the additions and updates, it's really just become a much more robust resource and much more rich. And we wanted to make sure that you had a bit of an in-depth peek at what has changed and all of the new resources and strategies that are available to you. So with that, does anyone have questions? Thank you, Jen. Put the link into the chat for everyone to look at too. Save it for later, and we'll make sure to send that out as a part of our follow-up email as well. All right, if other questions come to the surface, please feel free to put them into the chat. We will circle back to Molly and Harry a bit later as needed to answer or to toss those questions to them. With that, we are going to transition now to Libby Strunz from the Wisconsin Department of Public Instruction. She is a school mental health consultant, and she is here to talk today with us about the comprehensive school mental health framework and a variety of resources and strategies that the DPI has.
Good afternoon, everyone. Thank you so much for inviting me to join you today. Can everyone see my screen okay? All right, perfect. And Danette, can you just let me know, I know we have a full agenda today, about what time should I go to make sure I'm leaving plenty of time for our other presenters?
Oops. Oh, good question, Libby. You have a solid 30 minutes. So
Okay.
You take as much time as you need.
Perfect, thank you. And I did drop the link to my slides in the chat. And so a few of the slides I might move through quickly in the interest of time, but there are lots of links and helpful resources embedded into those slides. So in our time together today, we are going to talk about an overview of what we mean when we say comprehensive school mental health. We are going to do an overview of Wisconsin's comprehensive school mental health framework. There's 6 components that make up that framework. So we'll talk about a quick overview of each of those components. And like I said, there's some embedded resources. And then we're also going to talk about some ideas for county school collaboration. And when I say county school collaboration, that can include public health folks, that can include UW Extension folks, and any other county or community partners. So we'll take a look at some ideas for getting started with that collaboration. And I'm going to share an example of practice, and I believe there might be some other folks who are sharing examples as well. So Danette introduced me, but to just really quickly tell you a little bit more about myself and my background, I do use the pronouns she, her, and I work on the Student Services Prevention and Wellness team at DPI. So I do work related to comprehensive school mental health, trauma-sensitive schools, and bullying prevention work. So my background is that I was a high school English teacher for a number of years, and then I transitioned to being a middle school counselor, and now I get to support people in those roles at the state level, and also get to connect with partners who have an interest in building partnerships to do this work with schools. So first of all, we're going to start with a few definitions and an overview of when we are talking about comprehensive school mental health, what do we mean by that? So when we're talking about comprehensive school mental health, we're talking about a continuum of supports and services. And the goal of these supports and services is to promote positive school climate where kids feel included and safe and a sense of belonging and connection at school, to increase mental health literacy and social emotional learning competencies of our students and our staff, to promote positive mental health and well-being, all while working to reduce both the prevalence and severity of mental illness. So when we talk about this framework or the system, it is built on a strong foundation of school professionals, but we often say on our team that mental health is a team sport. So schools cannot do this work alone. It needs to be done in partnership with kids and families, as well as community partners, including public health folks and folks who work for UW Extension. And when we're talking about comprehensive school mental health, we are also keeping in mind that there's a variety of social and environmental factors, what our team refers to as social influencers of health and mental health, sometimes referred to as social determinants of health and mental health, that help to shape mental health outcomes for students and for staff. So we're keeping this bigger systemic picture in mind too. So this slide is our graphic that provides an overview of the 6 core components of a school mental health framework. So when we're talking about the building blocks of supporting student mental health in the school setting, these are our 6 key features of that system. And we are going to dive into each one of these. Again, just a brief overview. And you'll note that on this slide too, when we're talking about these 6 components, these don't exist in isolation. So they're integrated into academic initiatives at the school, into behavioral systems. We're not doing this work in silos. And then each of these components is also infused with our guiding principles of trauma-sensitive schools, so that we can ensure that our schools are places that recognize the prevalence and impact of trauma and adverse childhood experiences, that work to support all students, especially those who've experienced trauma, and help to create schools that are safe, supportive places where kids have trusted adults and strong peer connections that support their health and wellness. So the first component that we're going to talk about, and really the core of our school mental health work, is ensuring that students have access to a continuum of mental health supports. So a lot of times we see this represented not as a circle, but as a pyramid. So if it helps you to visualize it that way, feel free to. So at the base of that pyramid, or the first part of the circle, we have our mental health promotion activities. And this slide certainly does not have an exhaustive list of those, but rather a few examples. So when we talk about mental health promotion in schools, what we're talking about is universal supports that benefit every student and staff member, that they're preventative in nature. So that might include things like social emotional learning, mental health literacy and stigma reduction, work related to staff and educator wellness, bullying and suicide prevention. So again, universal preventative supports that benefit all students and staff. That next layer of our continuum of supports is early intervention. So these are interventions for students who might have emerging mental health needs. So this could be small psychoeducational or social emotional learning groups. It could be mentoring with an adult or a peer at school. It could be check-ins with those student services staff, like the school counselor or school social worker. And then our highest level on that continuum of supports, our most intensive level, are those treatment and crisis response services. And these are for students who may be experiencing more significant mental health concerns. So this might be therapy, like seeing a school-based mental health provider. It might be participating in wraparound services. And for students who are experiencing a mental health crisis, it might be something like doing a suicide assessment or completing a crisis support plan or safety plan with that student and their family members, and connecting them to supports outside of the school setting when necessary. So this is our continuum of supports. Again, that's really the foundation of our system. And on this next slide, I have a couple of resources that are great starting points both for folks in schools and those working to support educators and students in schools. So all of the resources that I share with you here today are free. They're all available on the DPI website. If you have ever tried to navigate the DPI website, you know that it's not easy to find what you are looking for. So I have included the links directly, and I would encourage you that if you go to that website and you're looking for something else, just use the search feature at the top. It's the best way to get where you're going. So a couple of resources that I have on here that I'll just go through very quickly are our stigma reduction toolkit. So this is designed for use with secondary students and works to help address some stigmatizing thoughts or beliefs or actions surrounding mental health so that kids can recognize when they might be experiencing a mental health challenge and need to seek support from a trusted adult, or they can help to also recognize when a peer might be experiencing a challenge that requires some adult support as well, and how they can help to support that peer in a supportive and non-stigmatizing way. We also have our bullying prevention toolkit. This is not a curriculum or series of lessons, but rather a guidance document for schools for bullying prevention and response procedures. And then we also have a brand new, newly released just within the last month, suicide prevention curriculum. And this has lessons for elementary, middle, and high school students, and is again designed to be part of a universal support. It's not an intervention for students who are experiencing suicidal ideation or behavior, but rather a universal preventative support to educate all students about warning signs that a friend or peer might be struggling with suicide and how to appropriately support them and seek adult support as well. So just a few of our resources, again, links to those are provided. So our next piece of our next component of a comprehensive school mental health framework is collaboration. And this is something I touched on already, this idea that in a school mental health system, it can't just be our student services folks, our school counselors, our school psychologists, our school social workers, our school nurses who are leading this work. It has to be something where every single person who works with students in the school system is committed to contributing positively to student wellness. So it also means that schools aren't doing this work alone. So they are relying on community partners, much like yourselves, to help make sure that this work is comprehensive and sustainable. So one great resource that I love that I wanted to share with you today related to collaboration is what we call our equity mindset cards. And these are designed by the DPI coaching team. And what they do is there are reflection questions, there are practices, considerations, practices to avoid when working to center some key aspects of equity, because we know that this work can't happen, whether we're talking about public health work or school mental health work. We know that this work can't happen if we don't have a specific focus on equity and looking at some of those social influencers of health and mental health and how they impact our students. So great resource for intentionally bringing an equity lens into this work and centering that. And it's something that can be used in staff meetings. It's something that can be used in community collaborative meetings. So just a great resource with a lot of different potential uses that focuses on making equity a center in this work. So our next component is needs assessment and resource mapping. And so these are probably processes that many of you are already familiar with or have helped to create for your community. And so in the school setting, similar to the public health setting, we are using the needs assessment and resource mapping process to help identify what supports and services we have, what do we need, and where are the gaps. So our needs assessment is being used to identify not just gaps, but also strengths of our students and families and educators to help us clarify our priorities and our quality improvement efforts with school mental health work and to really guide our action planning. And then when we are doing our resource mapping, this can be both internal to a school and external as well. We'll talk more about that because it's a great opportunity for collaboration between public health and schools. And so we're identifying, we're visually representing, and we're sharing information about these internal and external supports and services related to student and family mental health. So a resource that we have here is our resource mapping checklist. It's by no means comprehensive, but is a great starting point for schools and community partners as they work to start creating some of those resource mapping processes or improving resource maps that they already have. All right, so our next component is mental health referral pathways. So when we talk about this, essentially what we're talking about is formalized processes and procedures that help to ensure that students with both emerging and established mental health challenges are identified, referred, assessed, and connected to the appropriate resources. So again, these might be internal and external. A school might have a mental health referral pathway for internal services like small groups with the school counselor or services through the school social worker. And they might also have an external resource map about how students can get connected to therapy services with community-based providers. And this component also includes universal mental health screening. We're not going to get into that too much today, but just this idea that it's important to make sure we have processes in place to accurately identify students who are in need of support that help to mitigate bias. So if this is something you'd like to learn a little bit more about as you work to connect with schools and support them, we do have a module series specifically about referral pathways that provide some information and tools as well as examples about the process of creating and sustaining that referral pathway. All right, next we have sustainability. So when people hear sustainability in relation to school mental health, they often immediately think of financial sustainability, which is valid because we absolutely need funding to continue this work. And one thing that I'd like to shine a light on, though, is that sustainability, while financial sustainability is essential, sustainability also includes non-financial assets. So that can include the retention of staff. It can include educator wellness, because we know that our educators can't sustain this work if they aren't experiencing wellness themselves. And we know that educator wellness has to go beyond just encouraging self-care. Self-care is essential, but we know that educator wellness also has to include systems of support and policies and a school culture that promotes wellness. It also includes support from partners and buy-in from the community, adopting policies and procedures that support mental health and social emotional learning, and integrating school mental health work with other initiatives that the school is doing. So this work isn't happening in isolation. So a couple of resources for sustainability. One of my favorite resources, because it's not just available for schools, but for a variety of contexts, there is there's a few different community contexts where this is adapted to as well, is the Compassion Resilience Toolkit. And it is a resource that helps to support staff resilience and building of a compassionate staff culture. So it includes some things related to self-care and some things related to encouraging people to set professional and personal boundaries and build effective working relationships. But it also includes a lot of systemic lens, fostering collaboration and communication, and focusing on overall this workplace well-being, not just self-care for educators. So Compassion Resilience Toolkit, designed to help educators experience wellness and prevent burnout and compassion fatigue. And then I also wanted to share with you a great resource from the Coalition for Expanding School-Based Mental Health in Wisconsin, and that is their podcast series. So they have 13 episodes out right now, and each one of them focuses on one of these components we've been talking about. So if you're like, you know, Libby, this introduction that you did for 20 minutes today. It was intriguing. It piques my interest into how I can help schools with this, but I feel like I still have so much to learn about school mental health before I reach out to a school and help to partner with this. My advice would be to check out this podcast. It's really accessible. I put it on when I'm driving or taking a walk, and we'll just give you some great examples from across our state of how folks are doing comprehensive school mental health work. So just an excellent resource if after today you feel like you'd like to learn more before engaging in this work or continuing this work with a school if it's work you're already doing. All right, and then finally, our sixth component is data. So we know that data is essential in any type of system building and improvement work. So we know that it's important to have both quantitative and qualitative data related to school mental health. We want to look at implementation data as a way to assess the quality and functioning of our system, while also looking at impact data to measure the effects of the programs and practices we're putting into place. And then we also know that it's important to disaggregate data when we are working to center equity in this work, because it's important to look at how our system impacts specific groups of students, and also to identify if there are certain groups of students who might be placed at higher risk of experiencing mental health challenges. So for example, when we look at our statewide youth risk behavior survey data, we know that our LGBTQ+ students are placed at especially high risk of mental health challenges, experiencing bullying. When we look at our statewide data about adverse childhood experiences and trauma, we know that our Black and Indigenous students are more likely to experience adverse childhood experiences and trauma. So it's important to look at our local data, including some of the data that was presented to us at the beginning of our time together today. So those county health profiles are an essential piece of data that can also be used to inform school mental health. So an excellent resource for assessing a school's comprehensive school mental health system. So this isn't an individual student needs assessment or family or caregiver needs assessment, but what it is assessing the school's comprehensive school mental health system. So it's looking at these 6 components and assessing what is the school doing really well and what are some areas for growth. Where are some places where we have great momentum and where are some places where we might need to focus our efforts. So this SHAPE assessment, it's called the SMHQA, it's put out by the National Center for School Mental Health. So if you dive into it, you'll see that the language is a little bit different than what we use at the state level, but our state level framework is modeled on this national framework. So although some of the terminology is a little bit different, everything is aligned. So I have been talking for a while. I'm going to pause and ask you to put in the chat. So with the 6 components that we've talked about so far and some of the resources that I've shown, what is one component or resource that resonates with you as a potential entry point for working with schools to help advance their comprehensive school mental health work? So of everything we just went through, and I know I went through it really quickly, what's something that stands out as either an area of focus or a specific resource that you could see yourself engaging with schools about if you were to partner with them to do this work? I'll just pause and you can either just reflect on this or add it to the chat if you feel comfortable. I'll just pause to give folks a chance to put this into the chat if they'd like to. All right, so that resource mapping and needs assessment, absolutely. We're going to talk about that as a really great place to start. Resource mapping checklist, yes, thank you. All right, so feel free to continue to add those to the chat if you would like to. So I wanted to take just a moment to, and mental health referral pathways being in rural areas, recent hospital closures, yes. I know in the Chippewa Falls and Eau Claire area, recent hospital closures have impacted a lot of folks in terms of both physical and mental health access. So helping to make people aware of other resources in the community. Very beginning phase of collaboration with our schools. Excellent. We're going to talk about some specific ways that public health educators and experts can help to connect with schools. Excellent. So I wanted to take a moment to talk about the connection between educational and health equity. And I think that that's something that is maybe, you know, common sense for a lot of people on this call, but I wanted to show you this slide because we talk about it a lot when we present to school folks, how so I'm just going to read the quote. A comprehensive school mental health system increases health equity by ensuring that all students and staff have access to the prevention, early intervention, and treatment supports that they need when they need them, free of stigma. So we know that education can create opportunities for better health, whether that's because of access to income and resources, or social and psychological benefits, as well as health education and healthy behaviors. So the social emotional learning, the comprehensive school health programming that we're doing. And then we know in turn that poor health can put education at risk. There's that reverse causality. So whether that's because students are missing school because of health concerns, whether it's affecting their ability to engage in their education, we know that educational equity and health equity are really closely linked. And we know that they both exist in these larger contextual factors, these social determinants of health and mental health. So this is just something that we often include in slide decks when we're presenting to educators to just reinforce that educational and health equity are really linked, and it's important to address this comprehensively. So I wanted to include a few ideas, and this is really aligned to what I'm seeing people put in the chat, but include a few ideas for if you're like, okay, this, you know, this sounds interesting to me, or this is something that I've been wanting to do for a while, and I'm not quite sure where to start with supporting schools with this comprehensive school mental health work. So I have just a few ideas in here for you as starting points. There's certainly lots of other pathways to take, and I would love to share, to have people share, to put in the chat or in a little bit to unmute if they're engaging in some of this work, what their starting points were. So one potential starting point would be, like we talked about, doing work related to needs assessment and resource mapping in data. So lots of times, and when I was creating these slides, I thought back to when I was a school counselor and thought, what would have been some things that would have been really great to partner with our public health folks about? Or what are some things that we did partner with them for that were really helpful? So one was, oftentimes school folks are really well versed in their school data. So they might look at their youth risk behavior survey data. They might look at a needs assessment that they've done of students and educators and parents. But the piece that they could use support with is helping to look at some of that larger county level or state level data related to health and mental health, just like the profiles that were presented to us at the beginning of our time together today. So partnering with schools to look at both school and county and statewide data to identify concerns and disparities, as well as goals and priority areas for comprehensive school mental health work. And I included a link to a couple of tools that our team has recently developed. So in addition to the framework, we're not going to get into this today, but in addition to the framework, we also have a resource called the Roadmap for School Mental Health, which is essentially a step-by-step guide of how schools can use improvement science to build and sustain their school mental health systems. So embedded in that is a tool that we have called the driver diagram. I'm just going to bring that up. And what it does is it guides school and community partners through looking at data in order to identify a problem statement, which is something that is related to an outcome, a student outcome that is in need of improvement, and then identify goals, drivers that can help to work towards that goal, as well as specific change ideas. So again, in the interest of time, we're not going to go into this really in depth, but I do have it linked, as well as our Fishbone tool, which is a root cause analysis tool. So a great entry point can be to help schools dive into not just their local school data, but their county data in order to start their planning process of what they want to focus their efforts on. Another potential area for starting out when you're supporting a school would be creating a school and community resource map. So again, schools often have a great idea of the supports and services that are offered within that school, but they might need some support in identifying and mapping those community resources. So I've linked again that resource mapping checklist. And one example that came to mind for me is an example from the county where I live, Greene County, and it's actually our public health department that leads the effort in creating this community resource guide, which is fantastic and has information on everything from breastfeeding support to dental care to hotlines to emergency housing information to pregnancy services, healthcare, mental health care, grief and support groups. So I linked that in here as an example. And when I was a school counselor, this is something that I had printed and had available for students and families in my office. I put it out at open house nights and parent-teacher conferences and back to school. So it was a great example of taking this resource that had been created in my community and collaborating in order to share it and promote it and get it out to folks. So lots of opportunities for collaboration with creating a resource map. And then one other just potential place to start that oftentimes when I think back to my time as a school counselor, doing something like this was a little bit daunting until we started working with community partners. So forming a school community mental health alliance or collaborative or partnership or work group, whatever you want to call it, to collaboratively support student mental health and wellness. So that can include school folks, it can include county public health folks, it can include mental health providers in the community, it can include groups like sexual assault prevention and recovery groups, groups that help to work with folks who have experienced domestic violence. Any of these community agencies and groups, it can include business leaders or philanthropic organizations. So working with a school to help create a group like this, or I don't have this on the slide, but another great opportunity for connection and collaboration is helping to start and sustain a student-led mental health group like Raise Your Voice or Red Gen. There's a variety of them around the state, and if you're interested, I can share a map of schools that are participating in those peer-led mental health groups. But we know that that can be a really important protective factor for students. So helping to support the establishment of those at schools across your county would be another great opportunity for collaboration. So I wanted to share just a couple of resources from a county, Marathon County, that has been engaging in this work for quite some time. I have to give all of the credit to this work to Hannah Schomer, who is a public health educator in Marathon County. And she, with others on her team, has helped to create these resources that speak to how the county and schools have collaborated to support student mental health. So this is their main page that I have linked, where you can see that they've looked at some indicators based on their school and county health data. brainstorm some strategies to help improve those outcomes. And down here, and I'll just open this up. Again, I don't want to cut into the time of our other presenters, so I'm not going to go through this in detail today, but I really encourage you to take a look through this. What they have done with this resource is they've taken the DPI, Comprehensive School Mental Health Framework, so you can see those 6 components that we've talked about today. And what Marathon County Public Health staff have done in collaboration with the schools is they've created this map of how schools across Marathon County are using these components of comprehensive school mental health. And their public health team has helped to provide support for this. So it includes things like establishing Raise Your Voice student-led mental health clubs. It includes things like doing the SHAPE assessment that I talked about and helping to support schools with assessing their systems and looking for areas of focus. It talks about mental health referral pathways that exist in schools in the district and talks about the mental health navigators that they've partnered with to help build those referral pathways. It talks about data collection efforts. And so, again, just a great example of and you can see on the last page here, Hannah Schomer, public health educator. This is her contact information. And I'll let Danette speak to this, but I believe she may be able to join for a future community call or office hours. But her contact information is here. She's given me permission to share this. And so just some great examples of collaborative work between public health educators and school staff in order to achieve some of these outcomes. And then they also have an impact report, and it talks about their efforts for improving youth mental health in Marathon County, and it's from 2017 to 2022, and talks about some of the different strategies that they used. It talks about their community consortium of folks who participated in this and provides lots of data about the work that they did. So again, please take a moment to explore that when you get the chance, because it's just a really great example of this collaboration. So I will invite folks right now, if they'd like to put in the chat or unmute if any of you are currently engaging in this work and would like to share about what your entry points were or how you started connecting with schools to support school mental health.
I can go. I'm supposed to talk today anyway. So this is
perfect. Thank you, Michelle.
Yeah, so I'm from Forest County, and our population here is about 9,300. We're a very rural county. I'm pretty new to the health department. I've only been here a little over a year, but I'm excited to a lot of the stuff you're talking about, you know, our little community is doing. We have a lot of work to do yet, obviously, but we have 3 schools. We have Crandon, Wabeno, Leona, and the counselors are, you know, they're busy with the day-to-day, but they just hired the mental health navigators. I believe that was through like Project Aware, right? And this has been wonderful because they actually have the time. They're coming to our coalition meetings, our partnership meetings. The health department is very involved with the schools. There's 6 of us nurses here. I'm the full-timer and the rest are part-timers. But basically what we do is we just get to the schools one-on-one. You know, what do you need? Get in there, get to know, you know, the staff. We have a partnership that meets monthly. That includes health department, sheriff's department. We have 2 tribes, so it's tribal staff. And we just all collaborate on mental health. I go to the COPE groups monthly, so I come back and report what the other counties, what our neighboring counties are doing. And I'm happy to say they're getting Raise Your Voice up and going, and Sources of Strength has just started. So there's a lot of good stuff going on, but it's just us getting out to the community. If it's open house on school night, just meeting folks where they're at. And, you know, I'm the immunization nurse too, so I go out with with my team, and, we do immunization clinics, but if there's anything, folks need, I think it's just being there and being available and, getting that relationship with folks in the community.
Wonderful, Michelle. Thank you so much for sharing it. It's so great to hear you share all that, because it just reinforces everything I shared today, that it, like you said, getting out there, making those connections, and I come from a background of, I live in a rural community. I have taught and been a school counselor in rural communities. And I often hear from folks in rural communities that sometimes this work is more challenging because they don't have the resources that a more urban community might have. And we know certainly that in an urban community, there's challenges as well. And so I think the work that you're talking about is such a great, just a great example of how these partnerships and collaborations, there is so much potential, even in our counties that are under-resourced, that when I think about my school counseling work, one of my greatest partners was our county folks who helped to run an attendance program. And another one was our local domestic violence shelter, who came in and ran psychoeducational groups and social emotional learning groups for us, not specific to domestic violence, but about things like self-esteem and healthy relationships and positive decision making. So, this work just reinforces everything that you're saying, the importance of that collaboration and the community approach.
Yeah, we have a nurse too that we hired, probably, she's been here about 6 months, and she also goes into the schools and does art therapy. She's certified. And it's pretty cool. I think last year she saw almost 500 students. So she'll just go in twice a month to each of the 3 schools and meet with the kids, whatever. She goes to elementary, middle school, and high school. And they just do art projects and can talk. And so that's really cool. We have a garden at Crandon School, and we're working on the other 2 schools. And right now we're going to put some health and wellness, like positive little signs, and we're going to make a little pathway. So that's another connection we have with the school, just getting there. The STEM teacher has agreed to put it in the curriculum. So gardening will be, it'll be an actual thing in the school. So yeah, it's pretty cool.
I love that.
We just, getting in and just getting in with the kids and the students and the staff.
Wonderful. Thank you so much for sharing that.
Yeah, that's our good news in Forest County. We got a lot of good news. We're a tiny little rural county, but there's a lot of good work going on.
Absolutely. I see in the chat, Peggy had a question. Do you know how many schools or which schools are using the suicide prevention curriculum, and how are these tools shared with schools? So I do not have data yet for the suicide prevention curriculum because it's so new that it's just come out in the last month. We do with many of our resources. When you click on them on the website, it does ask you to put in your school district if you're affiliated with one. So we do use that to gather data over time about our different resources. We just don't have it yet for the suicide prevention curriculum because it's just come out. And so in terms of sharing those with schools, with the suicide prevention curriculum specifically, and I can find this and put this in the chat, there's a series of trainings throughout the state that are happening over the next year to help train people in using that. You don't need to attend the training to use it, but it's certainly helpful and just a great opportunity to brush up on skills. So I'll put the link to those trainings in the chat if anyone is interested in learning more. And then I will also just put into the chat my contact information if there's anything that you have questions about or want to reach out or need some help getting connected to a resource. I am absolutely available to speak over the phone or email, so don't hesitate to reach out.
Fantastic. Libby, thank you so much for all that you've shared today and brought. I think it was really fantastic how you tied together the value of our initial presenters, right, from county health rankings and roadmaps, how that connects to the work that the schools are doing and helps all of our health departments to be able to see those entry points into collaborating with schools. Michelle, thank you also for sharing your examples. She's right, that couldn't have been a more perfectly positioned little transition and segue that We didn't even script it that way, but thank you for jumping in at just the right time to share your story and the work that you have been doing as well. If you have other questions that come up, please feel free to put those into the chat. We do have one more county-based example of a health department and school and county collaboration. We have Rabia and Jesse, I believe, joining us from Winnebago County, and they have some slides that I'm going to share for them. We're going to try to work through this and collaboratively together. And I keep turning my video off because I'm a little nervous about my Zoom connection. So I apologize that I'm on and off the screen in that way. I also will just really encourage you, please hang on with us because we would like your feedback at the end around how today's session went. And that feedback form gives you an opportunity to request from us places you'd like to take a deeper dive as well. So we can feature those in office hour sessions coming up. So please stick with us. Make sure that you stay for Jesse and Rabia's presentation and then fill out our evaluation before we sign off today. All right. Let me get their slideshow up on this side. And then I will mute and let them take it away.
Good afternoon, everyone. My name is Rabia Wahid. I am a project coordinator for Breakwater. It's a DFC Drug-Free Communities Coalition. We are located at Winnebago County, their public health department at Winnebago County. We focus on preventing substance use prevention among youth. We also have our youth engagement coordinator today, Jesse. He will also be presenting part of the presentation. You can go to the next slide. Can you go? Can you please go to the next slide? There you go. Thank you. So Breakwater, again, it's a community coalition in Winnebago County. Our mission is to prevent and reduce substance use among youth. We offer like a lot of educational programs, youth leadership development, and other. We also promoted other community events. We have collaborated with a lot of schools, organizations, and community members to address substance use root causes. We have been around since 2013. We have rebranded a couple of times since 2022. We rebranded to Breakwater, which symbolizes the collective protection that Breakwater does. Again, it was formed, the coalition was formed by the community members and organizations really to prevent youth substance use. You can go to the next slide. So Breakwater created this, has worked on a lot of different projects throughout those years, but there were some community, there were some youth engagement projects that I'm specifically going to talk about today. We had the Be Courageous campaign that really aimed to lessen the fear surrounding these difficult conversations about substance use, and really encourage parents, guardians, and youth to reduce the fear of asking those tough questions and really stepping into this courageous conversation sort of a way. Also really empowering both adults and youth to initiate dialogue and support each other through tough times. Whether you're driving home, sitting at home, sitting at a dinner table, or going to bed, it's kind of like it's time to just time to start having that courageous conversation. We have held 2 Be Courageous parent panels with the Boys and Girls Club to discuss the initiatives and urging parents to engage in open conversations about substance use with their youth. We have also launched a website, podcast series, and stickers, T-shirts, and social media campaigns. If you go to the next slide, you will see we also where Breakwater also has launched a Breakwater podcast. It's the first Wisconsin's DFC funded coalition to do so. It really is kind of like created to enable the coalition to educate the community on substance use through diverse sectors. We have over 50 episodes released. We had over 3,500, it was streamed over 3,500 times. We cover various topics, such as discussing the impact of substance use on families, and also uplifting LGBTQ plus community. As research shows, those demographics are more prone to being impacted by substance use. We also discuss harm reduction and really exploring other prevention and even treatment guidelines in those podcasts. Again, the podcast was a huge success, so we trying to continue creating new podcasts involving community members and really engaging youth. If you go to the next slide, you will see there's another anonymous podcast that we created. So youth, that was really inspired by the Be Courageous campaign, the Be Courageous Anonymous podcast. Again, it really offers the youth to be open with adults around substance use and create this space where adults kind of like learn to talk about youth substance use prevention. They also kind of adults anonymously submit questions related to substances, and youth basically answer them honestly and anonymously. So the creation and implementation of this podcast has really encouraged you to have a voice in the conversation around substance use, really proving that they have the ability to change, to create this change in the community. If you go to the next slide, you will see a lot of other projects that Breakwater has worked on with other schools. So for the past 3 years, Breakwater has been collaborating with communities at Oshkosh North High School. It's a curriculum that youth have to be accepted into. And so instead of taking their normal social studies or English classes, they work directly with community organizations. So this is something they do every semester from February to I think till the end of May. So they were really, they were the one who kind of came up with the idea of Youth Anonymous podcast. They're also currently working on creating more substance-free events for youth. So in the next slide, you will see there a lot of when they were youth were working on this project, they realized a lot of youth were really frustrated that there was no place for students to go for free, hang out, have a judgment-free, substance-free space. In response to that, the students who were working last year, May 2023, decided to host an event, a substance-free event. They called it a sober party, tenacious night. The youth were the ones who really planned the event, created the event. They also worked with the community partners to obtain free space from YMCA Oshkosh downtown, and they even got free sponsors, free vendors, food. They even have prices donated from local establishment across the city. So just from that event, the word really spread all over the school about the Tenacious Night. So the students we have currently this semester, if you go to the next slide, please, you will see there's a flyer they created. So the students this year have decided to do something very similar. So they kind of created this Tenacious Night 2.0 to had like another opportunity to work with communities and really have this again, this sober party fun. They're having this glow themed bingo night. on April 29th. Again, there's free food, there are free prices. They got a lot of big sponsors to give them space. There's everything about this event is all paid for. Breakwater was just really helping them facilitate those events. So next event, you will see what we have been up to recently. So we have always struggled as a coalition, struggled to get youth involved in our coalition. We have our juniors project that happens every year, but after that junior project is over, it's really hard to retain those students who work on those projects. So in order to like really start a youth-led club, we decided to hire a third party. It's a contractor called Jake White from Vibe 18. Yeah, he hosts sober parties at colleges, but he also collaborates with other coalition or organizations to establish youth groups. So last year we contracted with Vibe 18 and we really started to create this safe substance-free environment for youth and really strengthening that relationship with schools and youth, fostering to prevent initiatives. So the first initial thing we did was to go to 5 different middle schools in Oshkosh Area School District in February and start presenting what we're trying to do. So from that initial presentations, the goal was to really form inspire students to get motivated and try to form a youth-led prevention club. We also have a goal to establish a citywide club at the Boys and Girls Club. We have our youth engagement coordinator, who's gonna talk a little bit more about what we're planning on doing in our Oshkosh Area School District. And unmute yourself.
Hello, I'm Jesse. I'm the Youth Engagement Coordinator for Breakwater. So like Rabia had mentioned, with Jake White coming to Oshkosh and doing these presentations, afterwards, so we had created this youth club. So it was a week-long thing, being in the middle schools, and then on Friday was the first group, and like with the goal to plan, sober parties like Jake had done within the college. So if you could go to the next slide, please. Thank you. So now Jake White, we had contracted, and for 4 in-person meetings where he came to just get the youth excited about this, and then I took over with the groups and then collaborated. Okay. I will try to hurry here. Okay, so we have these groups that the students had been planning, like these events, teaching them how to find sponsors, teaching them just all of these skills, and then seeing, like, this was kind of like how we got them like into the club, and just for them to see how like they can also have fun. Are you able to, so in the next slide there's a video. I think if we only have a little bit of time, if you'd be able to play that video, I think showing our first event would be good.
Substance-free futures. Substance-free futures, like alcohol and drug-free parties, to show people that you can have fun without using substances.
It was a lot of hard working and planning, but overall it was very fun. Just Dance playing. We have a bunch of fun glow volleyball matches that are happening. There's a lot of people here and it's great to meet new friends. And foosball, air hockey was cool.
To stay sober, because like you gotta live life to the fullest.
Don't do drugs, don't do alcohol, don't smoke.
I think not doing drugs is really important because when you're young, your brain is still developing. I've seen some people who just like get addicted to that and they can't break it.
Having good friends that don't do drugs, I feel like can help you have a better time.
I'm feeling like really happy, and yes, it's been fun.
A lot of people showed up today. I would say at least 50 people showed up today, and everyone had a lot of fun.
I just loved it, and I think it was amazing, and I think it'd be amazing if we could do more stuff like this.
I was hoping that we could do this next year also, because it was like a lot of fun.
The future is very important. We're the leading generation, so we need to try and invest ourselves and not do drugs, still learn to have fun, because everybody needs a break in their lives.
So we have one group that's within one of the middle schools, and so that's been huge just to have it during like their lunch hours where there's like no challenges with transportation, anything like that, and also at the Boys and Girls Club, you know, an organization directly for youth. And like now it's just seeing like where the students want to take the group, you know, like where do they see it going with like the prevention lens, you know, how are we impacting like students to make good choices and make good decisions. But I'll wrap up with that. Thank you.
Thank you.
Rabia and Jesse, thank you so much. I apologize. We kind of cut your time short here at the very end. Thank you for sharing your information. And if there's anything that you're willing to share, oh, I see that you put the link in the chat to the video. So if others would like to follow that, and we can share that out. We do have a youth wellness team member that we would like to introduce to you. So we recognize that our time is running low, but we have a youth wellness team member that recorded a video, and we said that we would share them with you each month. And so we want to go ahead and do that. And with that, I am also going to put our evaluation link in the chat. So you have that. If you could take just a moment while we queue this up. And Jen, if there's anything else you want to add at all, please feel free to.
Thanks,
Free
Danette.
to segue.
Thank you, Danette, and thank you all for staying on for a minute. As you've seen at the past couple learning community calls, we've been featuring different members of our youth wellness team, and David was able to stay on our last youth wellness team meeting to give us a little video about himself. So thank you, Danette, for queuing it up. If you wanted to push play, that'd be great.
My name is Javen. I use he, him pronouns, and I'm a senior at Middleton High School in Dane County. What health means to me is kind of like, it's like a really like spiritual kind of thing for me, like just being positive in my mindset, and obviously like physical well-being and like making sure that I'm okay, but like really making sure that I'm in the right mindset 100% of the time, and allowing myself to give my best energy out there. That way I can like be like mentally happy and like healthy with like how I'm like treating others. But then because like I feel that I'm such like a people person that I want to, that like helps me in return. It lets me feel healthy and like lets me be happy in that sense. But then also like being able to retreat when I need it, and understanding my needs, and like when I need my alone time to recharge, and that's health to me. That's being healthy. About myself, I was born in Tucson, Arizona, but I currently live in Middleton, Wisconsin. My favorite restaurant was Ramen Kid on State Street at downtown Madison, but unfortunately they just closed recently, so it's kind of sad. I guess like I have five pets, if that's a thing about myself. I'm really interested in social work. It's been something that I've always wanted to do since like I guess always is maybe an exaggeration, but maybe like eighth grade freshman year, I knew like that was like, yeah, I really want to be a social worker. But I really just want to be able to get into the community, get into communities, like work with the Madison community specifically. Because that's where I grew up, and I was surrounded by like substance abuse and just like not a great like healthy environment for like a kid to be around. And I really want to be able to get back in there, help the people that are struggling with those things, and just like lift them up and just be that person for them. The youth wellness team has been working on how to get youth voices involved in healthcare, specifically with like local and tribal health communities, trying to get those local and tribal health departments to just give better and more adequate care to the youth. And I guess just like just in a broader sense, like the state. So yeah. I would say like just being able to meet the different people in Wisconsin, because I mean, being in Madison, like or Middleton area, like it's like obviously the most, I guess maybe aside from Milwaukee, the most condensed part of Wisconsin, and then just kind of like the mindset between people, it's like different, not in like a bad way. It's just like you just like see like Wisconsin itself differently versus like from being from Madison, and then being from all the other counties, like what was it, like Marathon County, Brown County, like all those counties that are like way outside of Madison. So it's been really interesting meeting those people. I guess it's like, I mean, like the youth, like they really want to be involved in like their own healthcare and like helping other youth to be involved in their healthcare. So I guess just like taking those first steps to like get them engaged in doing those things. And like, that's like a big thing to say, because it's like, how do you do that? But honestly, it could be really just like really simple things, is getting in contact with schools, trying to just like talk to youth about like what they think and like know about their local and tribal health departments. And just like really just getting them engaged in like the simplest ways possible, because then that will build up into like being able to do bigger things.
Thank you, Danette, for sharing that. And this amazing group of young people is working with Taylor Steele and I on creating a youth engagement guidebook for you all to work with. So I'll pass it to you, Danette, to close us out.
That sounds great. Thanks so much. And we also will be featuring them in our June Learning Community Call. They'll just really take it over, and we're excited to meet all of them in that space and all that they've learned over the course of the year. Thank you all for staying with us and for giving us just a minute extra of your time. Please take some time to complete that evaluation link, share your feedback, your comments, and areas you'd like us to dive deeper as we move forward throughout the year in our office hours sessions specifically, and learning community calls. Our next office hour is May 9th. The one after that is June 13th, and you'll see us back here again on June 24th for the next learning community call. Thanks everyone, and have a great rest of your day and week.